thought you were redoing the venogram.
As soon as we're done with the arteriogram.
Okay, you're gonna feel a little poke.
Can you maybe do that?
Don't worry, it's just your leg. I don't have to go any further than this.
Take a look at this. Bones of your forearm.
Radius and ulna.
How about the wrist?
Lunate, hamate, the...
Scared lovers try positions they can't handle. It's a mnemonic for the wrist bones. It's the only way I can remember them.
Ow.
You okay?
Ow, my stomach.
You hit something?
Oh, it started.
Lie flat.
Oh, no, I can't. It hurts too much.
I'm getting out.
It's our only chance to see what's going on.
If he moves, I could shred his artery.
Get it out now.
It's gonna be okay, Stevie. Just inject the dye.
The dye's going into his liver, but it's not coming out.
The clot's gotta be constricting the flow in the hepatic vein.
It's not constricting it, it's completely blocking it. His whole liver's fried.
Just hold still, Stevie. This shouldn't take long.
Sorry, I'm guessing the mic in this thing doesn't pick up nods.
Smart kid.
Too bad it's all gonna go to waste.
Nothing wrong with being a salesman.
He should be able to pursue his own life, not be stuck helping his parents sell old toasters.
He's still young. You never know what he'll end up doing.
Unless he goes back to school, I know exactly what I'll end up doing. Wait. Is that a lesion?
Magnifying times 5.
It's a granuloma.
His Wegner's is most likely.
Stevie!
Mom, is that you?
Hey!
Get him out of this now!
Your son is sick. The sign on the door...
No, the sign says no metal. We took everything off.
says no admittance.
What's wrong with our son?
We don't know yet.
He's not gonna die, is he?
Your son is very ill. We're still trying to figure out why, which is why we need you to leave the room. What's with the clothes? You're not being discharged.
I know. It's my parents. They insist that I wear this stuff.
We insist on our own food, gown, and furnishings for a reason.
Hey, my chest burns. Are you sure the treatments are working?
Wegner's causes the body to attack itself. It doesn't get undone overnight. Be patient.
Where's your soup?
It's in the garbage.
It has willow bark extract.
Willow bark extract is basically aspirin.
Yes, for the fever.
He's already on meds, our meds. We can't risk any adverse interactions. We need all this stuff to go, but we need to control this environment.
So do we. People get sick for a reason. Because something in their life is out of balance.
Dad, he's a doctor. He doesn't want to hear your talk.
Balance is just starting to be restored now that that girl is gone.
That girl took pretty good care of your son while you were away.
Yes, we can see that.
All this stuff may make him feel more comfortable, but it's not
How
gonna...
long is this treatment gonna take?
We should start to see some improvement in his liver function soon.
Soon. Very scientific.
I'm sorry.
I'll be back in a little bit to check on you.
My people have been experimented on before, never again.
Mr. Lippo, with all due respect, comparing this hospital to Auschwitz, it's ridiculous. The FT-28's been proven safe in hundreds...
People always say you can trust them. Why would they say anything else? Why do they think we would listen?
Hey. You think I don't understand what it's like to come from people who've been enslaved, mistreated, and experimented on? Tuskegee went on for 28 years after World War II.
And the laws that made it illegal for the Romani to even set foot in this state were still on the books until 1998. It's not ancient history.
Conventional therapy hasn't worked. Your son may be dying. He needs a targeted approach, and you need to trust us.
I'm sorry. A lifetime of experiences tells me I can't trust you. And the past 3 days have done nothing to change that.
When our son treated, not experimented on. If you don't know how to do that, then just tell us so we can take him someplace where they do.
What's that?
Cyclophosphamide. We're continuing the standard treatment as you requested. I have to ask everyone to leave the room for a few minutes while I apply some bandages.
Why do we have to leave?
for his penis.
You lied to them. The bleeding stopped. I don't need any bandages.
We need to change your treatment, but your parents won't let us. They've got it in their minds that we want to try some sort of inhuman experiment on you.
The treatment's experimental?
FT-28's been through extensive clinical trials. It's also been used successfully for other conditions.
The fact that you're recommending experimental treatment means you have no other options.
Sorry. We stop the pleural effusions, your liver almost fails. We save your liver, the bladder fails. If we don't get ahead of the curve on this...
What do you need me to do?
Take the medicine, but don't tell your parents.
I don't like lying to my parents.
The rest of the world, though.
The rest of the world I can't trust.
You can trust me.
How do I know?
Because if you do this, then tell your parents, I lose my license.
Ow. Ow! Ow! God! Get in here.
Mucosa looks normal, healthy, no lonely diverticular.
Blood pressure's dropping.
He's bleeding again.
I mean, he's calling.
Hurry up.
Man, there's nothing there. Wait, what's that?
A reflection?
No, it's something. Looks like a toothpick.
Are you sure?
He must have swallowed it accidentally and just figured he'd digest it eventually. When you two were making out in the car, he must have folded awkwardly, pushed the toothpick through the wall of the intestine and into the lung. Then it moved onto his liver and made its way to his bladder and spleen.
So that's it. He's gonna be okay.
Yeah, small holes. It shouldn't take that long to heal now that we've got it out.
See? See what you did?
Me?
You hadn't been kissing him.
That's what you heard? It was the toothpick. It was that disgusting habit.
It
that
would have
you-
just passed right through him if he hadn't been writhing around. Isn't that right?
That's it?
Yeah, that's it. Wood absorbs water, becomes the same density as the tissue around it. That's why it didn't show up on the CT or MRI.
That's cool. I mean, not cool for me, but a lot of damage for something so small.
You know, the lab here, they have a paid intern position. It's usually given to one of the kids from the universities, but if you want, I could probably get you an interview. Yeah, some entry-level stuff, some gopher work, but you'd also have access to a lot of cool things.
Thanks, really, but I can't.
Yes, you can. Stevie, you're bright. You have more curiosity than 90% of the doctors on this staff.
It's not that. It's just... I go to work every day with my family, you know? People I've known my whole life. I don't want to lose that.
You can have both.
No, I can't.
Because they don't want to let you. They shouldn't be making you choose.
Maybe not, but they are. I'm choosing them.
Change is hard. Trust me, I know. But it worked out for me.
You're a successful doctor. Your name is on journal articles. I would love that. It's just... I see you with Doctors Chase and Cameron, and y'all got empty ring fingers. You're alone.
Matt, did you take any drugs this morning?
Pencils down.
Can you squeeze my fingers for me? Did anyone give you anything to help with the math test? Matt?
I told you, he doesn't take drugs.
Miss Davis, all parents think that about their children. And they're usually wrong. I gave my mum a little trouble when I was his age. I turned out okay. Even she thought so.
I know my kid. The fact that you did drugs doesn't mean he did.
Did he go anywhere last night?
No. He was home studying.
Any friends come over to help him?
And bring him drugs? Is that what your friends did?
Miss Davis.
Look. I tested him myself. The home kit. I took some hair off his brush. I didn't want him to know about it because I do trust him.
Then why did you test him?
All he did last night was study and argue about his college interviews. He wants to be himself. No haircut, ratty old clothes. That'll go over big. Then we both gave up and went to bed. That's it.
Has he ever had any problems like this before? Any family history?
No. It's just me and Matt.
Diazepam, 10 milligrams, stat.
Right, what's going on?
Taking some precautions. He's seizing. The poison's called disulfoton. This should bond with it and neutralize the poison. Then his nervous system will start sending the correct signals to the rest of his body.
But there was no well, that stuff in that can.
The label says disulfoton. I can show you.
But you didn't test it.
You said Matt sprayed with it this morning before school.
Matt started that garden himself for an environmental science class. They weren't allowed to use pesticides.
Apparently he cheated a little.
It was orange peel oil, totally organic. He dumped that other stuff last winter.
The symptoms fit. There must have been some left in the can.
If you're wrong, what will this treatment do to him?
Well, theoretically, it could increase the toxicity But we're not wrong.
Don't.
We're not wrong.
I can't let you do this.
Get a court order. Unless you want to see someone killed by sheer irrationality.
Maternal instinct is always irrational. Doesn't mean it's wrong.
Actually, that's the definition.
It doesn't make her mentally incompetent.
She is risking her son's life based on a teenager's claim that he washed something. How mentally incompetent can you get?
That's a brilliant legal argument.
Listen, have your Harvard law dog whip up some high-grade legal-sounding psychobabble. Temporary insanity brought on by acute panic distress syndrome. I don't care. We have to give him the hydrolase.
Her only sign of mental illness is that she disagrees with you. Some would consider that a sign of sanity.
Not the kid. Let's ask him. Oh, no, I forgot. We can't. He's dying.
Get the mother to sign off that she's refusing this treatment.
Goodbye. I, Margot Davis, have been informed of the risks which may arise from my refusal of advised medical care. I hereby release...
Who are you?
I work for the hospital. The Princeton Plainsboro Teaching Hospital and its employees, agents, and otherwise from any adverse medical conditions resulting from my refusal. It is not the hospital's fault if my son kicks off.
Kicks off?
I punched up the language, mostly for clarification. I understand my doctors consider my decision to be completely idiotic.
Why are you doing this?
But I am convinced I know more than they do. I took a biology course in high school. I assume that's... yeah. Besides, I enjoy controlling every single aspect of my son's life, even if it means his death. Sign here, please. I brought a pen.
Who are you?
I'm the doctor who's trying to save your son. You're the mom who's letting him die. Clarification. It's a beautiful thing.
My God, the things he said.
Dr. House wanted your son to get the medicine he needed. He was willing to do whatever it took to make that happen.
The wrong kind of medicine.
He didn't know that. At the time, it was our only choice.
He would have known if he had listened to me.
He listened. He just assumed you were wrong. To be honest, that's true of most of our patients.
You're just as pompous and superior as he is.
The county's worried about West Nile, so they sprayed ethyl parathion right next to the bus route.
Do you have the hydrolase for ethyl parathion?
Yeah, only one problem. Matt's mother faxes records to the CDC. She refuses to let us do anything until she hears back from them.
Well, you're getting good at this godlike doctor racket. Why don't you talk her out of this lunacy?
She's not really a big fan of mine.
All mine.
Well, only one man left in the bullpen, and he throws like a girl.
I hate sports metaphors.
Give her the high, hard one.
We really think the hydrolase is the only...
I'm thinking about transferring that out of here.
Miss Davis, your son is very sick. He won't survive a transfer.
I'm getting a second opinion from the Center for Disease Control.
Right. Look, when my grandmother got sick...
What? You're gonna tell me some tough decision you had to make?
I know how hard this is for you.
Maybe embroider the story a little, make it fit?
I can't imagine being in your position.
Honesty, a kind of vulnerable honesty. That's your thing. And the looks.
Boy.
They send a single woman to hustle the single mom.
Actually, they sent a doctor to tell you that if your son doesn't get this treatment, there's a good chance he'll die.
That's what House said about a treatment that would have killed Matt. You've got to do better than that.
No. It's on you. You need to do better. Right now. Yes or no?
I don't know.
Figure it out.
Wait.
I never bother to wash new clothes before I wear them.
Right. Your wife does. She likes you feeling nice and comfortable.
Hey, I'm a man. I don't have time for laundry. I'm saving lives here. No, she doesn't wash them either.
So your skin absorbs a little dye, the odd chemical here and there?
Well, you know me, Mr. Living on the Edge.
Judging by the self-importance of your strut, you have identified the chemical in question.
Fostrin.
Hit him with the hydrolase.
She's parents said yes, but...
Mighty mom said no. She's gonna feel like $1 million when she lives and her son dies. Sent Cameron. She's the only one of you who's managed to talk her into anything.
Not this time. Matt's mum won't make a move until she gets that opinion from the CDC.
Godot would be faster.
What is this?
Thought I'd hang out. In case you change your mind. And I could give Matt the medicine right away. Don't worry, I've got time.
The CDC promised they'd call.
I'm sure they will. Maybe tomorrow, maybe the day after. It takes time to review faxed records. And they'll probably tell you they can't make a decision based on faxed records. This is Susie. She's never gonna marry him. No money.
What makes you think you're right this time?
Same reason as last time. If you want to see how the other kid does first, that's okay. Might help you. Although there's a real good chance that
What? Matt might kick off?
it's a little blunt. I was going to say run out of time or just kind of let my voice trail off.
Hello? Yes, this is Margot Davis. But you have his records. I sent them. Yes, I understand. They can't help me.
They haven't seen him. They can't make a
Give it to
decision
him.
with it.
Please! My daughter needs help! Can you help us? Please! I don't know what's wrong with her.
I'm not gonna hurt you, okay? Take it easy. I'm not gonna hurt you.
I'm Dr. Charles. Can you tell me what happened to your daughter?
She's my crazy ex-wife. She's been unbalanced before, but...
Where's my daughter?
Ma'am, you can't...
Catherine!
You were keeping her prisoner. Are you insane?
You had no right to kidnap her.
My daughter needs to be discharged immediately.
I'm afraid we can't do that.
It's nothing you can help her with. I need to get her home now.
You're torturing her.
No, I am not the one who is harming her.
Who is? Who is harming her?
The demon we've been trying to exorcise.
The mom rat! Mom rat!
You see, my daughter is possessed. She's possessed.
So, Miss Campbell, when did your daughter start having these symptoms?
About 9 months ago.
And was she experiencing any emotional stress at the time?
I'm sorry, why are you speaking to her as if she's a rational person?
First, please.
No. She had just made partner at her firm, was seeing a nice guy. Then out of nowhere, she began acting strangely. She couldn't leave the house, couldn't work, she couldn't take care of herself, and so I brought her home.
There are a couple of tests that I'd like to run.
There's no point. I have taken her to countless doctors, psychiatrists. They have run all the tests. No one can figure out what is wrong with her.
So exorcism is the answer.
It was starting to work. She was starting to come back. Look, I am not a religious person, but I have exhausted every other option. Catherine wets the bed. She speaks in tongues, shouts at empty rooms.
There is no such thing as demonic possession.
I am not interested in your opinion. I want her discharged immediately.
I think it's safe to say that your daughter is a potential threat to herself, and it would be my advice to commit her, at least temporarily, until we can figure out what's going on.
I have power of attorney over my daughter's medical care, and if you put her on a psychiatric hold, I will have my lawyer down here.
Miss Campbell, your daughter is severely dehydrated, malnourished. At least let us hang some IV fluids until we stabilize her.
As soon as she's rehydrated, I am taking her home.
Dr. Reese, could you please take Mr. Ferris to the consultation room? Thank you.
I love my daughter.
I am sure that you have her best interests at heart.
Thank you.
We are going to take care of Catherine as quickly as we possibly can. In the meantime, why don't you try and get yourself comfortable in the waiting room?
Thank you.
What are you thinking?
Well, the mom seems kind of rational. Last possession case I read about, the underlying issue was actually neurological. I think maybe we could sneak her in for a quick MRI, see if we can cross that off the list.
Yeah, I'll let radiology know she's coming.
Okay. It's very often emotional distress that triggers this kind of disassociative state.
What kind of emotional distress?
We were hoping you could tell us.
To be honest, we'd just begun to reestablish a relationship. I hadn't seen Kat much after I split with her mother 22 years ago.
Why not?
Well, it was a pretty ugly divorce. I mean, you've seen how unstable my ex-wife is. After we split, she poisoned my relationship with Kat. And that's really my biggest regret, is that I let Samantha push me out of my daughter's life. But once I reconnected with Kat, I swore to her that I would never let that happen again.
And when was that, you two reconnecting?
About a year ago, I reached out to her.
And what prompted that?
I had a heart attack, and it nearly killed me. And I swore that I needed to make up for lost time. So I would fly in once in a while, we'd go out to dinner, and then she moves back in with my ex-wife and stops returning my calls, and then I get worried. And so I fly out here to see what's going on, and now it's all this.
What if Catherine's suffering from severe separation anxiety?
From her father?
She lost him once in the divorce. He has a heart attack. She almost loses him again.
Well, according to his version of events, I guess that's certainly possible.
I don't know where it leaves us, though. It's not like we can get someone in Catherine's state to open up.
Her sedation's worn off. She should be awake. Good luck.
Hi, I'm Dr. Charles. This is Dr. Reese. Could you tell me your name?
You're in the hospital. You're safe.
Is that your name?
Mom rat!
Take it easy. Take it easy. Little help, please. Push two of her said.
Got it.
It's just gibberish. Make some the moon breath. Make some moon breath.
Not so sure about that. So, believe it or not, there is, in fact, the case to be made that your daughter is possessed.
What?
Not by a malevolent demon, but, well, by her 6-year-old self.
6-year-old self? What do you mean?
We suspect that this could be the result of a trauma she experienced when she was a little girl.
I don't understand.
It's called dissociative repression. Disagreeable memories or personality fragments are split off and then pushed down into the subconscious.
Yeah, in your daughter's case, this fragment has resurfaced and perhaps hijacked her entire persona.
How could you possibly know that's what's going on?
Well, aside from the bedwetting and the tantrums, the biggest clue is her language. It took me a while to realize this is not all gibberish. It's Lewis Carroll. It's a poem called Jabberwocky from Through the Looking Glass. Do either of you remember reading this to her when she was a child?
I didn't.
No, I don't think so.
No?
Wait. You did. When she was little, I remember.
Mr. Ferris, would you mind just reading a little bit of this?
Oh, this is ridiculous. Psychobabble. Look, my daughter's very ill. She's not a child. She's a demented adult.
Just humor me, please.
No, we need to take her to a real expert and not this quack.
Just read the damn book, Jerome.
No, I'm not going to do it. It's ridiculous.
In that case, will you allow me? 'Twas brillig, and the slithy toves did gyre and gimble in the wabe. All mimsy were the borogroves, and the momraths outgrabe.
No.
Stop it, you're upsetting her.
No.
Beware the jabberwock, my son. The jaws that bite, the claws that catch.
No, please.
Stop this!
No! Please, don't!
Oh, my God. Oh, my God. I remember she'd be crying. She'd say it was the monster from the book, and I thought it was all in her head, but it was you.
Now see what you've done. I told you that she's unstable.
Oh, I always suspected you, but I didn't want to believe it. I couldn't believe it.
You're insane.
You touched her?
Oh.
You did things to her?
I've heard enough of this.
God.
I'm not listening to this anymore.
Oh, my poor baby. Oh, my God.
Dr. Reese.
How could you do that? A child, a little girl.
Leave me alone.
You destroyed her, you know
Dr.
that?
Reese, enough.
You are the demon, you!
Dr. Reese! You let this go, you hear me? He might be a monster. He's not the one who hurt you. He's not the one you want to be yelling at.
Were you part of the crush? Did you get the wind knocked out of you? Is that why you passed out?
No, I got dizzy before anything happened.
And what about the vomiting?
I don't know why.
Did you buy candy? Or that horrible buttered popcorn? You know, that's not even butter.
No, I didn't eat anything.
Everywhere you go, junk food. When I was a teenager, I thought I could eat whatever I wanted. Of course, I got fat.
All right, well, your heart's regular. Your lungs are clear. How's the nausea now?
A little better, maybe. I don't know, I just always feel kind of blah.
What about that meal I packed you? Did you eat that? I make her healthy options. She won't eat them.
They're gross sides. They make me feel bad, too.
Okay, let's run some tests and see what comes back. Food allergies, infections, these could lead to extended periods of nausea. A nurse will be in to draw your blood. Give me some baseline labs, CBC, CMP, prealbumin, MAG, UA, HCG, a urine tox, and find me Dr. Charles. Thanks.
The nurse will be with you in 5 minutes.
Dr. Charles.
This poor fella in here. Agoraphobic. Picked today of all day to go to the movies.
I know you're busy. I just need a quick consult. I've got a 16-year-old patient, emaciated, persistent nausea, but her blood work's normal. No food allergies, she's not pregnant, and her mom's all over her about food. She has all the indicators of anorexia.
Eating disorder is so tricky to diagnose.
I've seen it before. My best friend in college, she was anorexic, starved herself to death. Her mom, just like this one.
Terrible disease. You're pretty sure it's what we're dealing with here?
Mm-hmm.
Let's take a look.
Great, this way. Ashley, Mrs. Cole, this is Dr. Charles. I've asked him to consult.
I am so sorry about the awful day you've both been having, but Ashley, I understand you're not feeling well and haven't been for a while. Some tummy issues?
Yeah.
So you and food not on the best of terms right now?
I love food. I just can't eat it.
So why is that?
It makes me throw up.
Any food in particular, or?
Everything.
Well, that's no fun.
Makes me nervous just thinking about eating.
I don't blame you.
Are you a gastroenterologist?
No, I'm a psychiatrist.
No, this isn't that. It's her body that's in trouble.
What if I were to give Ashley something to make her not feel sick? Do you think you might be able to eat then?
I guess so.
You know, FDA has just approved a new anti-nausea drug. Remarkable results in clinical trials. You should be able to eat anything you want.
Anything. A hamburger with fries.
She can't take all that grease.
Cafeteria grill's a pretty mean burger. We could give one a try.
Sure.
Ashley.
Mrs. Cole, could I get you to go with me on this one?
Okay, yeah, I suppose.
Great. I have some samples up in my office. I'll have them sent down, and then we'll order you that burger. Nice to meet you both.
Just hang tight. Hey, what's the name of that medication?
I got a board member in my office in 5 seconds. Page me at burger time.
This is so good.
Honey, please, don't eat so fast.
No, I'm fine, really.
She's gonna be sick.
Here.
I knew all that grease would make her sick. So much for your magic pill.
You okay? Has it passed?
I'm sorry Ash was having such a tough time, but her response has actually told us a great deal.
I should hope so.
Dr. Charles?
Dr. Manning, be right back.
What did you give her?
A Tic Tac.
A Tic Tac?
Yes.
You gave my patient a placebo?
Yep.
That's not ethical.
Oh, balls. Look, nausea, no nausea. I now have a much clearer picture of what's going on. I needed to get around Mother and see that girl eat.
No, I could report you. I should report you.
Dr. Manning, you ever heard of bias confirmation?
What?
Bias confirmation. Interpreting information so that it conforms to one's preconceptions. Look, you walked in, saw a thin 16-year-old girl with an overbearing mother who reminded you of your college roommate, who, very tragically, died of anorexia. So, voila, the patient has anorexia.
She has the indicators.
She also has the contraindicators. If the mother were that overbearing, she never would have allowed Ashley to choose that particular meal. And if Ashley were anorexic, she never would have eaten it, let alone with such gusto. The mother is right. It's Ashley's body that's in trouble, and that is your department. Thank you.